Welcome to The Cellar. Luigi Mangione has shown a big bright spotlight on the United States healthcare system. The American healthcare system is broken. It has been broken for a long time. Canada, the United Kingdom, Australia, Norway, Germany, France, Sweden, even Brazil. All these countries provide free healthcare to their people. Healthcare in America is a for-profit system. Problems within a system like this are higher costs. For-profit hospitals typically are the highest billing within the United States, and the healthcare system turns their profits with predatory practices, resulting in many people being unable to pay for basic care or life-saving medicine. If you can't afford good insurance, you're in danger of receiving reduced quality of care, limited access to necessary services, higher costs for patients, and potentially straight-up neglect, as healthcare decisions in America are often made based on financial gain rather than medical necessity. The system promotes higher costs compared to nonprofit healthcare. For-profit entities charge higher prices for services due to the need to generate profit for shareholders. In the end, it's all about the bottom line. Now you may ask, where does all the profits go? Well, let's take a look. In 2023, Andrew Whitty, the CEO of United Health Group, was the highest paid health insurance CEO. And how much was he compensated? Oh, just a cool $23.5 million. To put this into perspective, that's 352 times the median salary of a United Health employee. But that's just one man, one CEO. I mean, they can't all be making $20+ million a year. Oh wait, David Cordani, the CEO of Cigna Group, earned $21 million in 2023, 280 times the median salary of those that work for Cigna. And it continues. Joseph Zabreski, the CEO of Molina Healthcare, earned $21.5 million in 2023. That's 273 times the median salary of a Molina Healthcare employee. That's 3 CEOs of 3 insurance companies making a comfortable $66 million combined for 1 year. There are 334.9 million people living within the United States. An estimated 27.1 million people do not have health insurance. That's 8.2% of the total population, while the health insurance industry turned a total profit in 2022 of $41 billion. The scariest stat is this. It's estimated that the people of the United States of America are in debt, medical debt, upwards of $220 billion. That debt is not just those without insurance, as many who have insurance can't afford the kind that covers what they end up needing. Many go into massive debt that they simply will never be able to get out of, just so that they can keep themselves or their loved ones alive. While the healthcare industry rakes in billions, the American people suffer day in and day out. Those that can afford good coverage aren't even safe at the end of the day, as the insurance companies actively search for loopholes to deny care and life-saving treatment. When patients are denied, a lot of the time, they have no way of overturning said denial. Those who choose to buy their own insurance or get it through a government job or program, such as Medicare, have the right to sue for damages if they believe an unreasonable denial has harmed them. But a lot of people within the US get their health insurance from their jobs. When you get your insurance through your employer, you're left with no right to go to court. It doesn't matter how flagrant the denial from the insurance company may be. In 1987, the Supreme Court made a ruling that people with employer-provided coverage do not have a right to sue their insurer for damages. They only have a right to sue for the value of the denied benefit. As claims are denied, medically necessary procedures and medicine are left in limbo. Some don't have the time to wait, as their condition can get dramatically worse in a short period of time. Now, due to copyright issues, I had to remove the audio from this next clip. This is a clip from Michael Moores Sicko Documentary about a woman named Julie Pierce. In the clip, it's discussed how Julie has health insurance through her employer. Julie works for the nearby hospital, and her husband is suffering from kidney cancer. Every step of the way, their doctor found options to try and save her husband's life. Every step of the way, their claims were denied. The last effort they made was to try for a bone marrow treatment that could potentially get her husband back on track. Upon testing her husband's brothers, they found one was a match. They took this to their insurance and were once again denied. They then attempted to appeal to the board of the hospital and were once again denied, being told they viewed it as an experimental procedure, even though the treatment had been done before and had shown promising results. The end result of all of this is a heartbreaking one.
The doctor told me he would die in 3 weeks. On January 13th, which was my birthday, he went to sleep. And he died 5 days later, here at home.
In the end, the health insurance companies bank on this, it seems. The idea is to get as much money out of those that pay for insurance while giving back and spending as little as possible for their healthcare needs. That's the problem with the for-profit healthcare system. But how did we get to this point? Was the American healthcare system always this broken? In the 1980s, American healthcare costs began to skyrocket, which coincided with a broad push towards deregulation. Let's first put into perspective how doctors and hospitals were paid. Before the 1980s, Medicare and other insurers paid the hospitals based on cost. If someone was having a surgery and said surgery was to cost, say, $10,000, they would be paid that amount plus a reasonable extra for profit. But soon, private insurance and programs like Medicare began changing. Thanks to Ronald Reagan and the Social Security Amendments of 1983, the Medicare Hospital Prospective Payment System was put into place. This caused a significant change in the Medicare program where hospitals were paid a fixed amount per patient case based on their diagnosis-related group. Hospitals would receive a predetermined rate for each patient's admission based solely on diagnosis. It didn't matter how much the care actually cost in the end. It was up to the hospital to cut costs where they could in order to even try and break even or turn a profit. This placed financial risk on the hospitals and doctors. Over time, this approach spread like wildfire, leaving providers in a system where if they could get costs down, they could make money. If they simply couldn't, well, then they lost money in the end. This shifted how medical care was given in hospitals. Back before the 80s, it wasn't uncommon for a patient to have a procedure and remain in the hospital for aftercare, but soon that would transition to outpatient services. Reagan embraced deregulation, and soon for-profit companies became common within the healthcare system for the first time, their focus being that of revenue and profit maximization, not cost control. The United States embraced deregulation healthcare markets. No other advanced democracy did so like the United States. This approach soon became the norm through healthcare and the U.S. economy. Ronald Reagan single-handedly deregulated the American healthcare system, and we have been suffering the consequences ever since. When the gap between the poor and rich becomes greater in a country, healthcare will typically suffer along with it. Between 1982 and 1985, the poorest Americans lost 9% of their wealth, while the wealthiest gained 9%. In my research, I found a quote by former President Jimmy Carter, and I feel it really sums things up well. In a country as rich as the United States, blessed with talented medical professionals, world-class hospitals and research institutes, and an almost unparalleled capacity for technological innovation, the lack of universal health coverage should be a national scandal. In the early morning hours of December 4, 2024, United Healthcare CEO Brian Thompson was shot just outside an entrance to the New York Hilton Midtown Hotel. His death sparked a massive manhunt. At the same time, his death lit a fire under many Americans. Now, I want to make it very clear, I never will, never have, and simply do not condone murder. I don't think that offing some insurance CEO is going to solve America's healthcare woes. But following his shooting, it has been even more apparent that the American people are angry, and they should be. The healthcare industry has been taking advantage of the American people for far too long, stacking their profits on the numerous bodies they lay in their wake. Luigi Mangione was eventually apprehended as the suspect in the killing of Brian Thompson. From my research and what has been released, the gun found on Mangione matched the shell casings that were found at the scene of Brian Thompson's death. A lab also analyzed evidence from the crime scene and found that Mangione's fingerprints were on a water bottle and protein bar wrapper found there. A manifesto was also discovered, one that was circulated through many major news outlets. Those outlets quoted from the manifesto, but for some reason didn't want to release the entire thing, which begs the question why? What happened to public disclosure? Why does the media in this day and age look to keep things out of the public spotlight? For now, we will stay on topic, as the American media and reporting of news is a topic for a whole other video. Now, let's take a quick look at Luigi's manifesto. There are a few parts that have been shown to be indecipherable, so if I state indecipherable, that is why. To the feds, I'll keep this short, because I do respect what you do for our country. To save you a lengthy investigation, I state plainly that I wasn't working with anyone. This was fairly trivial, some elementary social engineering, basic CAD, a lot of patience. The spiral notebook, if present, has some straggling notes and to-do lists that illuminate the gist of it. My tech is pretty locked down because I work in engineering, so probably not much info there. I do apologize for any strife of traumas, but it had to be done. Frankly, these parasites simply had it coming. A reminder, the US has the #1 most expensive healthcare system in the world, yet we rank roughly 42 in life expectancy. United is the indecipherable largest company in the US by market cap, behind only Apple, Google, Walmart. It has grown and grown, but as our life expectancy? No, the reality is these indecipherable have simply gotten too powerful, and they continue to abuse our country for immense profit because the American people has allowed them to get away with it. Obviously, the problem is more complex, but I do not have space, and frankly, I do not pretend to be the most qualified person to lay out the full argument. But many have illuminated the corruption and greed, example Rosenthal, Michael Moore, decades ago, and the problem simply remains. It's not an issue of awareness at this point, but clearly power games at play. Evidently, I am the first to face it with such brutal honesty. As I stated before, I don't condone the murder, but Mangione isn't wrong about the American healthcare system. At the crime scene, the words deny, defend, and depose were discovered on the bullet casings, obviously referring to the tactics that insurance companies use to avoid payouts, denying payouts, which in turn increases their profits. Brian Thompson's death has sparked a lot of debate, with some saying that Brian was a devoted father and a good man, while others have not been so kind. A common phrase being thrown around right now is thoughts and prior authorizations, a play on the phrase thoughts and prayers. This ultimately comments on the number of insurance claims rejected by United Healthcare and other insurance companies. Some have even expressed gratitude for what Luigi Mangione has done. This all too evident with the campaigns online looking to raise money for Luigi Mangione's legal expenses. At the end of the day, what happened was a crime, and if Mangione is found guilty, he should pay the price for what he did. At the same time, the healthcare system in America is now under a spotlight, and people should be angry. Change needs to happen nationwide, and we need to make that change. The voice of the American people needs to be heard, and it's going to take each and every one of us to do so. We need to engage with elected officials to advocate for policy changes like expanding access to affordable health care and support initiatives promoting preventative care. We all need to become more educated about healthcare issues. One of the biggest things we all need to do is vote for candidates that want to reform healthcare. Universal healthcare is something that I hope my kids one day get to experience. In the end, it won't be easy, as there is so much money on the line for insurance companies, big pharma, and the politicians who have made a lot through the numerous lobbyists that both health insurance companies and big pharma have. If you're uncertain if universal healthcare works, well, let's just take a look at the stats. Norway has universal healthcare. Norway is listed as having the 7th best healthcare in the world. Japan has the 2nd best healthcare in the world. They also have universal healthcare. Germany is ranked 13th. They too have universal healthcare. The Netherlands are ranked 11th. Also universal healthcare. Australia, 21st. Same thing as the others. Do you know where the United States are ranked? 69th. 68 other countries are said to have better healthcare. Yet the cost of healthcare in the United States is more than any other country in the world by a mile. That is absolutely baffling, but also not surprising based on where things have gone over the last few decades.
Differently. In the United Kingdom, they have what people call socialized medicine. The government owns the hospitals, and the doctors and nurses are government employees. For most medical services, you don't pay anything directly. You go to the hospital, get treated, and leave. There's no bill you have to pay, and you're not paying for health insurance every month. In Canada, they have a single payer system. Doctors and hospitals are private businesses, but private insurance is rare. Instead, the government provides health insurance for everyone, and they're the single payer that then pays the hospitals and the doctors every time you have an appointment. In Switzerland, people buy private insurance from companies, but it's heavily regulated by the government, which requires everyone to have health insurance and even pays for part of it if you don't have enough money. It's kind of like a more intense version of Obamacare.
In the end, can change happen? Yes. Will it be easy? Not at all. Big pharma and insurance companies have legions of lobbyists going around with blank checks. They find their way into pockets of the elected officials that are supposed to be looking out for Americans' best interests. In the end, it's all about money. It's all about the bottom line. In order for things to change, America needs to wake up and the people need to demand the change they want and deserve. In closing, if you enjoyed today's video and want to dive into this topic more, I have to recommend you watch a documentary film titled Sicko by Michael Moore. Sicko came out in 2007, but I think it's just as relevant today as it ever has been. In fact, Michael Moore was recently reached out to, as he was name-dropped in Luigi Mangione's manifesto. I will end today's video on what Michael Moore had to say. Go to michaelmoore.com if you want to read the full thing. I'm going to take a few snippets from what he had to say and read them to you now. Here's a sad statistic for you. In the United States, we have a whopping 1.4 million people employed with the job of denying health care versus only 1 million doctors in the entire country. That's all you need to know about America. We pay more people to deny care than to give it. 1 million doctors to give care, 1.4 million brutes in cubicles doing their best to stop doctors from giving that care. If the purpose of healthcare is to keep people alive, then what is the purpose of denying people healthcare, other than to kill them? I definitely condemn that kind of murder. And in fact, I already did. In 2007, I made a film, Sicko, about America's bloodthirsty, profit-driven, and murderous health insurance system. It was nominated for an Oscar. It's the second largest grossing film of my career after Fahrenheit 9/11, and over the past 15 years, millions upon millions of people have watched it, including, apparently, Luigi Mangione. After the killing of the CEO of United Healthcare, the largest of these billion-dollar insurance companies, there was an immediate outpouring of anger towards the health insurance industry. Some people have stepped forward to condemn this anger. I am not one of them. The anger is 1000% justified. It is long overdue for the media to cover it. It is not new. It has been boiling, and I'm not going to tamp it down or ask people to shut up. I want to pour gasoline on that anger. Because this anger is not about the killing of a CEO. If everyone who is angry was ready to kill the CEOs would already be dead. That is not what this reaction is about. It is about the mass death and misery, the physical pain, the mental abuse, the medical debt, the bankruptcies in the face of denied claims and denied care and bottomless deductibles on top of ballooning premiums that this healthcare industry has levied against the American people for decades. With no one standing in their way, just a government, two broken parties enabling this industry's theft and, yes, murder. And now the press is calling me to ask, why are people angry, Mike? Do you condemn murder, Mike? Yes, I condemn murder, and that's why I condemn America's broken, vile, rapacious, bloodthirsty, unethical, immoral healthcare industry, and I condemn every one of the CEOs who are in charge of it, and I condemn every politician who takes their money and keeps the system going instead of tearing it up, ripping it apart, and throwing it all away. We need to replace this system with something sane, something caring and loving, something that keeps people alive. I have a solution. The solution is simple. Throw this entire system in the trash, dismantle this immoral business that profits off the lives of human beings and monetizes our deaths, that murders us or leaves us to die, destroy it all, and instead, in its place, give us all the same healthcare that every other civilized country on Earth has. Michael Moore has made his Sicko documentary available on YouTube, free to watch for everyone. If you haven't, I highly recommend you take a moment to do so. Whether you're Democratic or Republican, it really doesn't matter what side of the aisle you stand on. All Americans are affected by the barbaric system. There are only 800 billionaires in this country and 6 million millionaires, but there are 160 million working-class citizens that should be outraged and should stand up and say things need to change.
Got a little bill today from Scripps Medical Center. I'll just share with you what the total amount was. Obviously, there's going to be some adjustments, and I want to kind of walk through the scam of the U.S. healthcare system. So the total bill was just under $6,000. It was $5,900. I want to point out what was done during this ER visit. He had a very basic set of chemistry labs done. They put a little bit of IV fluid in him, somewhere between 250 and 500 cc. Yeah, and that's it. And then he went home. Let's see how that adds up to $6,000. There's a pharmacy charge for $20. I'm guessing that was the IV fluids. There was some other charge for $683, unspecified. This one's my favorite. Lab services, the basic metabolic panel, sodium, potassium, those things, $2,412. There was emergency services. I'm guessing that has to do with something doing in the emergency room. That was $2,752. Now, astonishingly, our insurance company, Aetna, decided that they would be willing to pay about 4,000 of those dollars, which left us with a $2,000 bill. But I think this is the single greatest problem of the U.S. healthcare system, which is that you have a completely artificial set of costs that are a part of everything. And this is why, you see, we pay 3 times per capita in healthcare what any other country pays in the developed world. And
I don't know what the answer is. I'm just a YouTuber who's passionate about this topic. I've actually found myself in a position where starting January 2025, I have to navigate the healthcare marketplace. As I began looking at plans and costs, I was stunned. I do not have the answers or know-how to fix America's healthcare industry. All I know is that the way things are, well, it's simply broken. So thank you for watching today's video, and please check out Sicko, which is available now on YouTube. Thank you all for tuning in to another episode. If you enjoy the content, please hit that like and subscribe button. It helps the channel continue to grow. It's also very important that you hit the notification bell and turn on notifications, as you may not be alerted of my uploads if you don't do so. In the description box below, you'll find a link to my merch store and a link to the Cellar Dwellers membership tier for the channel. If you're interested, please take a moment to check those things out. If you'd like to submit your own scary story or any kind of story recommendations, you can do so using the email linked in the description box below. As always, I do all the research, writing, recording, and editing for the channel myself, so anything that you do to support this channel is greatly appreciated. And until next time, I will see you all again as we head back into the cellar.